All right, welcome everybody. Most of you guys already do know me, but just to introduce myself, I am Dylan Valenzuela with ICANN Wellness. I'm the director and owner of ICANN Wellness, and so what I provide for a lot of my patients is dietary counseling and strategizing. But Kristen Porter here, she's a nurse practitioner for Lively Integrated Health. She's actually going to be talking today about men's health and testosterone therapy. So this is very important for our just general health and wellness, and we're trying to build a full spectrum health and wellness for all of our patients. We're not just looking for dietary strategies of reducing diabetes. We're also looking at testosterone. We're looking at cardiovascular disease. We're looking at depressive disorder. A lot of things that deal with our hormones are due in part to either diet or possible a lack of those hormones. So I'll hand it over to Kristen Porter, and we'll do a little Q&A at the end. And I appreciate you guys being here. Thank you.
I'm Kristen Porter, family nurse practitioner and one of the owners of Lively Integrated Health. So we are the wellness company that came in to this building like a wrecking ball and kind of threw our lively flair, if you guys have saw it before. And now we graciously, with Barb's approval, of course, have done some redecorating and totally encompassed that space in the back and then up here as well. We are all about optimizing health and wellness. So we have 3 different tiers of our company where we do IV infusions, mobile IVs, and then also in-office IVs, vitamin injections, B12 shots, skinny shots, stuff like that. We have a team of nurses that comes to your house or works in office here. And then we also have a tier of aesthetic services where we do hair restoration services with microchanneling, hydrofacials, Botox, Xeomin, all that fun stuff, basic facials as well. And then we have a tier of wellness services. So we're passionate about helping people just live their best lives and feel their best from the inside out. So that looks like a lot of different things. So for some people, that's weight loss support with semaglutide, generic Ozempic or brand name if it can get covered, tirzepatide, brand name Mounjaro, but the generic version. Other peptides for weight loss support, and then hormone therapy. We are passionate about optimizing hormones. There's a lot of research out there where there's normal levels and then there's optimal levels, and we definitely operate in the optimal ranges. And so when we look at the labs, we don't just say, well, everything looks fine, if it's not in red. We have different targets that I'll talk about a little bit, and those targets are different for everybody because we weigh heavily on how you feel. So it's not just about the number and it's not just about you feel, but it's mixing the two. And a lot of the most current research really supports that, where, it doesn't have to be the traditional morning test less than 300. And, that's the only way that you're going to get testosterone therapy. There's a lot of emerging research on the benefits of optimizing it at other levels as well. So we do all bioidentical hormones. We're passionate about making sure it's the most healthy and safest option when we do hormone therapy for both men and women. And we have a few different routes that we go about that. So today, though, I'm going to share a little bit more about testosterone therapy, and please feel free to, ask questions or raise your hand as I go, or we'll take some questions at the end. Okay, so to start out, lots of benefits of testosterone. Most of the majority of Americans just think of it as, in 2 things, increases libido, increases muscle mass, but it is so much more than that. There are huge cardiovascular benefits of it. It's actually heart protective. There are huge metabolic benefits of it too, decreasing your risk of diabetes, decreasing your risk of insulin resistance, all of which is super important, with Dylan's, education and services as well. It also is really good for mental health. It really improves men's sense of well-being, can help with brain focus, clarity, combat those, burnt out feelings of like, oh, I'm just stuck in a rut, or feeling just down, or I'm feeling like super anxious and I don't know why. And, all of those things that we all can get struck with. It can enhance weight loss, especially with extra adipose tissue or fatty tissue around the abdominal area, visceral fat, which we all know is, the worst kind to have. And it can help sleep. All of us, probably could use a little bit of help with our sleep. And that, of course, is going to have a cascade effect of healthier inside and out, better moods, better energy, all of that good stuff. So we'll dive into a little bit. I wanted to start, though, with why there's so many gaps in the practices and guidelines. And so I kind of touched on that, old school or more traditional, whichever way you want to look at it, providers will only treat based on true hypogonadism, which is 2 morning levels less than 300. Newer education is leaning towards meeting in the middle of this other big funnel that I have here, where a lot of men that are on testosterone I don't even know where they get it from, but they don't even have their testosterone levels checked beforehand. Maybe a third of them aren't even really meeting criteria, but they're still provided with it. And then about half of them don't even get their testosterone levels rechecked after starting on it. So there's kind of these two waves of, or two ends of the spectrum of treatment, and we kind of meet in the middle because there is a lot of issues with, gaps in guidelines and what the best practice is. And I'm huge on evidence-based practice. And the most recent evidence is really supportive of bridging that gap and meeting in the middle, where it doesn't have to be to less than 300 morning levels. But also I want to check your labs, and I want to make sure we're safe about it, and that we're therapeutic, and we're going to check labs after starting treatment as well. But we're also really heavily weighing in how you feel, because that is a huge indicator of if the treatment's effective as well. So it's important to bridge that gap. I kind of touched on just that it's so much more than just the things that we think of. So it really is going to improve your cardiovascular risk. It's really going to prevent the chance of heart failure, prevent the chance of diabetes. Overall, those with low testosterone just have an increased risk of mortality, which is, yeah, so with low T, overall increased risk of mortality, which means death, sadly. And that's a scary fact, but that's just even more supportive of why it's important to supplement with it, whether through testosterone therapy or natural ways. I'm going to go over 2 natural ways to boost your testosterone levels. And then, of course, if you tend to have lower muscle mass, more extra adipose tissue, or trying to lose weight, then you are probably at increased risk of having low testosterone show up on your labs. So this gets a little bit more detailed, but I know, Dylan would appreciate this, of just really, why that happens. And so when we have excess fatty tissue, it makes these adipokines and cytokines that really disrupts our hormonal system. When we have that disruption, that leads to this whole cascade of effects that can be considered metabolic syndrome, insulin resistance, mess with our metabolism, lower sex hormone binding globulin, which is super important to actually bind to those active sex hormones so we can use them. And then that staggering fact that if you do have low testosterone, you're up to 4 times more likely to develop diabetes. And we, of course, that's all of our goal, is to not get that and to reverse that risk, of course. So we'll go into a little bit more detail on, why those things are important. These are the obvious, most common things that we already know about. But just into more detail of why it's important. So of course it's important for reproductive health as well. And that does kind of lead me to the thought of, that is one reason why we may go more natural route of supplementing your testosterone or boosting your testosterone versus actually supplementing with it. Because if you do plan on having future children, if you are going to do testosterone therapy exogenously or outside of the body, it does decrease your internal production of testosterone. And so it can potentially affect your fertility in the future. It's not guaranteed to affect it, but of course it's an important discussion that we want to have if future children is something that you're wanting to have. There's other options, though, of things that we can choose if that is the case, but it is just something, to keep in mind. But there is protocols where even if you're, unsure on future children, where we can do testosterone therapy, and then there's a protocol of weaning off of it where we can boost back your LH and FSH, which are the hormones that are going to produce your own testosterone inside your body. To just get your own production boosted back up after you've been on testosterone therapy. So, of course, it's huge for libido. And then, of course, it's huge for muscle mass and just really protein muscle synthesis and strength and endurance. Endurance is a big one, too. It's not just about gaining muscle, but you might feel like your endurance, like, you used to be able to run a mile, no big deal. And now that seems like a huge struggle. So it can help with that as well. So bone density, it actually stimulates the mineralization of our bones. And so that's huge, especially as we age. We all can lose, the strength of our bones, and puts us more at risk for fractures and injuries. So you want to, if you're supporting with testosterone boosting therapies, whether with testosterone therapy or natural ways, you're going to prevent your risk of osteoporosis and fractures. It also is going to just really help with your fat distribution and promote a more lean muscle mass, less adipose, excess adipose tissue, especially in that belly region that we all can struggle with. And then energy and mood, it's huge just for vitality overall. If you have any friends or family on testosterone, a lot of them, that's the first thing that they will notice is they're like, I just feel better, like I was just in a funk and I didn't know what it was. And is in midlife crisis, like all these different things, that people can use those terms for, but it just helps boost your brain and your cognitive function, which is amazing. Really reduces that risk of depression too. Just some more on cognitive function, of course, and then also red blood cell production. So that's what's red blood cells are what deliver oxygen to our tissues. So of course you're going to have improvement in that. That does, though, sometimes we get too many red blood cells produced when we're on testosterone therapy. And old ways of teaching would say then you need to go donate blood and get off those excess red blood cells. But newer research is showing that's really not the best treatment option, because then you're just really going to tank your ferritin levels, which are your iron storage. And so there's other things that we can do versus jumping to that. So grapefruit extract, which has naringin in it, actually helps remove old red blood cells, which is super interesting in a natural way. And so that would be something that we would talk about if you got to have too many red blood cells, where we wanted to just cut back and get rid of some of those older red blood cells without having to go donate blood. I mean, I've had guys tell me they will do therapeutic phlebotomy at home and literally put a needle in and drop blood into the trash can. And it's mortifying to hear that. So there's other ways, as the moral is, versus doing that. Metabolism, huge for insulin sensitivity, insulin resistance, reversing that. So, which is amazing. And then just hair growth. So, you might notice your beard is coming in less thick. Maybe your hair is not as robust anymore. That can also be a sign of lower testosterone. And so when you're supplementing or boosting your testosterone naturally, then you can see an improvement in your hair growth as well. Any questions so far?
So we're going to turn into big hairy beasts?
Yeah, pretty much. Yeah, just Aquaman, walking through here. Long locks to build muscles. That's the goal.
I will not go there.
Yeah.
I'm going more for Wolverine.
Wolverine. Okay, yeah, there you go. That's probably even a better, hairier example. So I love this image. It just gives a great visual of how our testosterone levels drop, because that's a big question too. Is even Dylan was like, when do we start checking? In our 30s, is that fine? Because a lot of times you think you have to be in your 50s or 60s or something, and absolutely not the case. After age 30, our testosterone levels can drop, or men's testosterone levels can drop by 2% every single year. So you can see that you're already, maybe a fifth or so-ish dropped by age 30. Look at age 40, by 50, close to half of what you had at age 20. And so our goal is to, if we do, especially if we're doing testosterone therapy, is to really boost you back to those levels of when you were 20. And, if you remember those days, you probably felt awesome and had all this energy and, could make gains in the gym, no big deal. And, had a great mood and slept well. So that's kind of the goal. So this is just, I thought this was a funny image, but another way to think of when to start checking your levels, is if you start to, develop any of these, even just one of these, really can be linked with testosterone. It doesn't have to be all of them. That's another common misconception, that you have to have this slew of events. Why wait until you have all the things, if you just start to notice one or two things, that might be time to really optimize. So, the lack of focus, the fatigue, those are probably two of the biggest things that I have men say that they notice. And then just the libido, decreased muscle mass, where they are working out in the gym, doing all the things and not seeing progress with whether it be weight loss or muscle growth either. So then a little bit more, into those symptoms without just the fun little image, but cognitive abilities are huge. When we're at our jobs and not functioning the way we used to be and thinking, is this ADHD? What is happening? I can't focus. I can't stay on task. That, can definitely be a sign of a hormonal imbalance. And just the physical changes too, just especially that fat around the belly area. And then just, difficulty really maintaining those muscles, even when you're trying to maintain them with high protein, resistance training, etc. Mood swings. So that's another one that, of course, we always think us women, are the ones with the mood swings, but men can have that too. And, if you feel like your mood or emotions are more labile and up and down, that is a sign. Reduced motivation and drive, where, it's just kind of hard to feel great about getting up and going to work in the morning, or, spending time with the family at night. You're just I'm over it. I'm exhausted, all that stuff. Of course, the libido changes, changes in sleep pattern, and then the hair growth, as we talked about too, can all be signs of that. So treatment options. So kind of as I mentioned, a lot of providers, even urologists, like specifically, they are very by old school traditional medicine practices where they want to see less than 300 testosterone levels before they feel comfortable starting to treat. And our treatment is not like that. So we want to see that you're not optimal, but that you're also having symptoms and that there's some improvement to be had. Most men feel better around 600 to 800, but I have some guys who feel great around 900 to 1,000. I have some guys who feel better, their best, a little bit less, 550 to 600. And you'll kind of see, you know, with how you feel and with your lab results, you'll kind of know like, okay, yeah, no, I feel my best here, you know. And that's great because then we just titrate your dose very specifically to how you feel. We're also big on customized treatment plans. A lot of places, you know, they just blanket put every man on this sort of dose and, you know, we'll see you in 3 to 6 months or something. We're not like that, where we want to make sure we're titrating that dose as often as we need to, safely checking labs as often as we feel we need to, and really making sure you're feeling your best. Excuse me. So the two treatment options that we do are pellet therapy and injections. Some men, you know, will do creams or patches, things. It's just, I'm just not a fan. It's not as effective and it's not as safe. So pellets are amazing. That's what Avexipel, we're, myself and 2 of our other providers are Avexipel certified. Avexipel pellets are plant-based bioidentical hormone pellets that are a little bit bigger than like a grain of rice that are inserted just into your subcutaneous fatty tissue and kind of the love handle area. It's a 5-minute in-office procedure. You're numbed super well, of course, beforehand. And then it's something that stays there for 4 to 5 months and you don't have to do anything else every day. The amazing part is that the way that they're created, they're coated in triamcinolone. So they're the only FDA patented pellet as well, which we love. So the coating actually really reduces the risk of pain and inflammation and extrusion or any other issues with the pellets. And it really provides just a slow, steady release of testosterone into your system over that 4 to 5 months. After you get them inserted, we recheck your labs in about 5 weeks, see where you're at. At that time, you can get a boost with some more pellets if you need them, or we just, you know, let it be, and then you come back in 4 to 5 months, recheck your labs again before that time, and reinsert the pellets. It's amazing. Guys love it because it's easy. You don't have to give yourself shots. You don't have to have that pain of a shot once or twice a week. But of course, you know, one negative is that once you put them in, you can't take them out, of course. So, you know, some guys aren't comfortable starting with that, and that's totally fine too. You know, we can always start with injections. And then if you're like, I love this, I want to just not have to give myself a shot once or twice a week, then we can always transition to pellets at that time. So injections, more mainstream, but what might not be as mainstream is that you can do it sub-Q, subcutaneously. So I brought actually a syringe because I wanted to show you guys how tiny this is. The testosterone that we prescribe, excuse me, I'm getting over this cold like everybody, is in MCT oil. So it can be given sub-Q, super tiny, tiny, tiny needles. So it's not this, you know, massive, you know, thing that you have to put in your thigh into the muscle. You can still inject into like the fatty tissue or just make it shallow in the muscle. You can do it in the belly, you can do it in the back of the arm. Really amazing. Excuse me. I love compounded testosterone. From Strive specifically is where we most often prescribe it from. It's 7 minutes up the road, local. It's in MCT oil, which is far less inflammatory. Commercially prepared testosterone, not guaranteed to be bioidentical, has a lot of preservatives in there, and it's compounded often in grapeseed oil, which is a seed oil, can cause a lot more inflammation just throughout the body. So it's really lots of benefits to using the compounded one. Any questions on?
Do you see more efficacy with pellets versus injections in regards to the improvement, excuse me, sooner rather than later? Do you see it more with pellets versus injections or vice versa?
Yeah, so you do feel better with pellets faster, usually within 2 weeks, whereas injections can take 4 to 6 weeks.
Okay.
So you do tend to feel better. Also, we're able to get your levels a bit higher with pellets. So especially if you're someone that, feels better with a little bit higher 1,000 level, of testosterone, which is probably what you were at when you were 20, then that's easier to achieve with pellets as well.
And is there a certain type of patient that you would not suggest for pellets? Are there any categories of patients, like, you're at a high cardiovascular risk disease, or you're type 1 diabetic, whatever it might be? Is there any reasons why everyone couldn't just do pellets if that was the case?
Yeah, no, that's a good question. So testosterone therapy in general, the main contraindication would be active or past prostate cancer. If you've had past prostate cancer, we would just want to have your urologist sign off on that. And we, of course, always are monitoring your PSA, prostate-specific antigen, with testosterone therapy as well. But those are the two biggest contraindications. Untreated sleep apnea is another one where if you have sleep apnea and you're not treating it, I would recommend that to anybody. But before we would start testosterone, we want to make sure you're at least just treating that, just for good, safe measure. But those are the biggest two things. But there's no real difference of being a candidate for pellets or injections. Yeah.
Quick question, since you started with the prostate.
Yeah.
Just natural, enlargement of the prostate as you age.
Mm-hmm.
Does this aggravate that and thereby make nighttime urination more difficult?
Yeah, no, that's a great question. So it can actually improve it. So a lot of men will have those like LUTS type symptoms, where you notice that difficulty with a steady stream or nighttime urination, different things like that, dribbling. And this can actually improve those symptoms and improve the prostate health. So with the PSA, it's something that we monitor. It's very, very, very low risk of having any elevation with that, but it's still something that we, of course, want to monitor. But if you've had a history of specific just cancer, not the other prostate sort of issues, that would be the only real concern. But if anything, men can find improvement in those symptoms with testosterone therapy. Good question. Any others?
What's the difference in cost?
That's a good question. We're going to go over that. Yeah.
So
Yeah, and that's
one other quick thing.
Yeah, of course.
I've always encouraged my son to, whatever you do, do not go on testosterone stuff that you get off the web for bodybuilding.
Yes.
How is this different than the stuff that you see there?
Yeah.
Roid rage.
Yeah.
Bodybuilders.
Yeah, great question. So that stuff is not bioidentical. That's the biggest thing. It's synthetic. Bioidentical is huge because that means it's molecularly mimicking our body's testosterone, our human body testosterone. Those also are probably unregulated. I don't know that there's any third-party testing done with those compounds, where that makes me very nervous to know. Are you getting 200 milligrams per ml? Are you getting 100? Or are you getting 500? Whereas using compounded testosterone, they're using FDA-approved sources. They're licensed by the Board of Pharmacy, the state board. There's third-party testing being done for potency and purity. So it's much safer to know what you're getting. It's kind of like, supplements is another thing too, where just even a vitamin D pill, you don't know. That's why it's important to use quality ones that are third-party tested, just versus whatever off of Amazon, because you don't know really what's in that. And there's a lot of lack of regulation over supplements in general, and then especially those ones online, or I've heard of people getting stuff in Mexico. Yeah, just for bodybuilding. Testosterone is a controlled substance, so you have to have a provider's license to prescribe it, and it's a big deal. And so I just, like you said, I would just caution, from using it from anywhere else, because who knows really what's in it. And
So it's not horse testosterone.
Horse testosterone? Horse testosterone. No, it is not horse testosterone. Yeah.
Well,
Yeah, that's probably out there, I'm sure. Yeah.
the guy was at the big advertisements in magazines, and it's not, like 5, 7-year-old guys that look like bodybuilders.
Mm-hmm.
They were doctors, and they were injecting guys with horses.
Really? Yeah, no, I do not feel comfortable doing that. There's probably some guys out there, maybe you get amazing horse-like results, but I just, or a tail, you never know. But and that is the issue, is that why I think there's so many common misconceptions, because there's that, and then there's those that will hardly even prescribe it. And so there's just such a wide array of thoughts. And so But that's why it's huge looking at the evidence. And some of these pamphlets down here too, like really are evidence based. They cite articles in there, on bioidentical testosterone use in men and especially pellet therapy too. So
this is plant-based.
Plant-based. It's plant-based from like wild yams actually and other plant compounds. So fully plant-based, nothing synthetic in it. Yeah, it's amazing. Yeah. Okay. So before we get to price, actually, I realized I have my natural ways to boost testosterone. So of course, these can all be done with doing testosterone therapy or without. These are some great options, especially if you're kind of like borderline or maybe just have a couple symptoms or, want to try these routes first. The first slide is, just everything Dylan preaches, of course, exercise, sleep well, hydration, all the things. It's amazing that high intensity exercise and just any exercise regularly can boost your testosterone levels anywhere 17 to 34%. So that's a great way to boost. Decreased alcohol intake can help as well, and just getting within a healthy BMI. And then there's some more specific things as well. Plastics, a simple thing is, not microwaving in plastic containers. This is a huge thing of why I think more of us men and women are having hormone disruptions at a younger age, is because of just all of our environmental exposures, whether it's just in the air or, we're eating out of hot plastic containers, styrofoam. Styrofoam is, we have styrofoam. We've got to get rid of the styrofoam. I just realized that. I was like, no.
Like, all right, maybe sure
Yeah.
one got it right.
Yeah. So definitely, styrofoam, especially for hot things, is not advised. And then just not microwaving in plastic containers. It's something that's an easy thing you can adopt at home. Heat up your food, just transfer it to a plate or a glass bowl, before heating something up. Even those factor meals, like that are in plastic, I'm like, I agree. I need to get better at just transferring that to a plate and heating it up that way. So we all know more about BPA. Of course, that's been more wide known. Phthalates is another huge thing in hygiene products. Your deodorants, your shampoos, different things like that. It's not just important for women to have clean skincare. It's important for men too, and just checking if at least that it's, sulfate free or the phthalate free, it would be awesome to just start incorporating that into your regime as well. And then pesticides, herbicides, if you have bug spray treatment or do it yourself, try and just keep those products on the outside of the home, not really necessary or advised to spray those inside the house, and, just avoiding contact with those when at all possible, because they really can disrupt your endocrine system. You can see more men even sometimes in those fields with some hormone disruption, as well as like women or men in the beauty care, like hairstylists and stuff, because they're constantly exposed to these chemicals, and that's just unfortunate. Our aesthetic side too, we try and stay as clean as possible with our products, and some of them can be used for men too, especially like the hair restoration products. So stress levels, of course, which Dylan talks about too, and cortisol levels, that can actually impair our testosterone levels as well. When we have more aromatase enzyme, that is what converts testosterone into estrogen, and so we don't want that to happen. We want it to stay as testosterone. There is a good healthy amount of estrogen that men need too, though, and that's another thing that some older schools of teaching will do aromatase inhibitors to block that conversion of testosterone to estrogen if you're on testosterone therapy. And we don't believe in that either unless it's absolutely necessary, because there is benefits to having estrogen in your body as well for men as well as for women. And then eating well, just having that good anti-inflammatory clean diet, it makes a difference. Buying organic whenever possible. Brazil nuts are an excellent source of selenium, which is a fantastic trace mineral for our bodies. There's some different supplements that can be helpful as well as boosting testosterone. There's also, like Avexapel makes a supplement that contains a lot of these things plus more. It's amazing. And so that would be one option that you could do with or without testosterone therapy to just boost those levels in a more natural way. And DHEA is awesome. DHEA is the precursor to our androgen hormones, and it's an over-the-counter supplement. And when you take that, that can boost your testosterone levels in a more natural way too. It can help with libido, energy, sleep, etc. Okay, so now we get to the cost and stuff of stuff. So kind of the steps that we take is, those that got lab draws today, that's awesome. So that's step one. If, you want to discuss, and Dylan and I will talk to, I have access to look at all the labs as well and see if that's something that we want to set up an appointment. If you're like, yes, I for sure want to, go for this, then we can set up an appointment today, or you just reach out. We would go over your labs and develop a really specific treatment plan. Kind of as I mentioned, you do see better improvement or quicker improvement with the pellets, but if you want to start with injections, that's totally fine. And then we repeat labs in 4 to 6 weeks, and then again in 3 to 6 months, depending upon if you're doing pellets or injections. We have a few different payment options. So we have testosterone membership, which is an awesome deal. It includes your consultation, your testosterone, either picked up from Strive or shipped to your home. You do the injections yourself, or if you come see Dylan weekly, he sometimes does them for our combined patients as well that don't want to inject themselves, or we have nurses that can do them too. But so it also includes any future lab draw, that $30, usual. It was waived today and it would be waived in the future as well. Or we just have a la carte options where, we can just have a consultation. We can just do the vial of testosterone and kind of go from there. Or the pellets. So typically it's $700, but we were going to offer $100 off for anybody that was here today, if that's something you're interested in. And you don't have to sign up today or anything. You would just mention, or I would know your name that you were at this talk. That includes everything. So that includes your consultation, the actual pellet insertion with the bioidentical pellets, the repeat lab draw, and then a boost if you need it in 4 to 5 weeks, depending upon what those labs are. We would put some more testosterone pellets in if needs be. And then you're set. We would, let you go and see you again in 4 to 5 months, just for that repeat lab draw and then consultation and do the pellets again. Yeah.
So it's $600 every 6 months.
Correct. 4 to 5 months. So I would say it depends on kind of how you feel. We would probably schedule you in like 4.5 months. But if you're like, I'm still feeling fine, let's wait another couple weeks, that's fine. And then you would just come in, get your labs drawn again, and then we would follow up about a week after. So we're really trying to combine all the things. So we would have your lab results, we could repellet you that same day, and then off you go again.
Insurance covers a lot of that?
No, unfortunately, it depends. So we as Lively as a practice don't contract with insurance, but we do have forms that you can provide to submit to your insurance and maybe get reimbursement. It depends on your insurance though, depending upon if they will reimburse or not, but we're happy to provide all the ICD-10 codes. The issue with some insurance companies is, especially if we're not treating for a number less than 300 on 2 separate draws, they won't consider that true hypogonadism, and we're considered off-label treatment. And so, insurance companies are really picky about that sort of thing. So, but we're happy to provide the documentation to try and get reimbursed. The good news is though, we do take HSA or FSA cards. So if you have like a health spending account, flex spending account, any of our services that we have, you can use that card or that payment form to pay for that. We do also have payment plans. We have an app where you can do payment plans to break up the payments through Affirm. And anytime you sign up for the app, there's a little thing up front. You get $25 off your first service. So it would be off of any of these things as well too, or anything else we offer. Yeah.
Then it goes back up to $700 for the next one.
Correct. Mm-hmm. Yeah.
Does the pellet come with the tracker?
No. Good question. No.
They inject it right there.
Yeah.
My wife can find me.
Yeah. No, that is a good question. No plant-based trackers that I know of yet. So no, we're definitely anti-tracker or all the things like that. So valid question though. Yeah.
Can you feel the pellet? Like, is it just right about?
Yeah. So typically not. No, it goes in there enough where you're not going to feel it. It's maybe an inch-ish under that fatty tissue. And it's so tiny and soft that it's not something that you would feel. There's no suture or anything after. It's just a steri strip. And the little teensy-tiny incision used to insert them is, I would say, maybe like the length of this, the diameter of a straw. So it's very, very small. So you're not looking at a big thing. And then it's right under the adipose tissue. So yeah, good question though.
Mm-hmm. And then besides the restrictions for the first I saw earlier, the first 5 days, no rigorous exercise, things like that.
Mm-hmm.
That's not a problem.
Yeah.
Pellets it is.
Yeah.
But besides that, are there any other restrictions, like for instance, like with continuous glucose monitors, like I can have patients who CT scans or MRIs.
Mm-hmm.
Are there any restrictions for any patients
Yeah,
like that.
no, that's a good
Yeah.
question. Nope. Yeah, it doesn't contain any sort of like metal or anything else or anything that would disrupt the CGMs or anything like that. So,
Swimming.
yeah. Swimming after 5 days. After 5 days. 5 days is also no swimming or hot tubs, just because you really want that wound to heal and not become infected. So I know, yeah. And to be honest, we say 5 days because realistically, absolute minimum, it should be like 3 days. So, but we just, say 5 days to just be extra safe.
When I say swimming, that's a generous term.
Okay.
I'm more like cold plunge.
Oh, cold plunges, cool. That's a good question. How long do you cold plunge at a time?
Anyways, from 5 to 10 minutes.
Okay, good for
It's
you.
not about, it's like no different. I would say no different than a shower.
Okay, good for you. That's awesome. I would clarify specifically probably with our Avexius partners, but I would think that might be okay because it's quick, it's very cold water, it's clean water. It's not.
And I can also put a Band-Aid around it.
Yeah, if you could put it, that would be ideal. Yeah, like some sort of Tegaderm or like occlusive material over top. Yeah, absolutely. Yeah, good question. Any other questions on this slide? No.
So once you start this treatment, is it kind of an ongoing thing?
Yeah, that's another good question. So it doesn't have to be, but if your levels have declined, there's just probably a reason with age or whatnot that it's declined. So for the most part, if you feel better while on it, your levels aren't. If you go off of it, your levels aren't going to just magically stay up again. They would go back to where they were beforehand. So you don't have to stay on it by any means. If you're like, it wasn't worth it, or like financially I can't really renew it at this time, that's okay. You would just let them dissolve and go off of them and then come back if you wanted to. It's not something that you have to by any means, but most guys feel a lot better, especially depending upon what your number is, that they want to just continue on with it. So yeah. Any other questions? No? Okay, and I think that's probably it. Yeah. So questions, we kind of went that. So this is my contact information. I also have a card right here, so you can grab a card. Kind of the next steps, we'll wait for your lab results, look over that. If you want to get scheduled something for, the end of next week today, you can. If you kind of want to wait, that has our QR code for our website. We have online booking available. Also calling and texting our office line, which is the same as right here. It goes to our front desk. We have a gal up here Monday through Friday, but it also goes to my cell phone. So I'm always responsive on there as well. Yeah, there's some other literature here too that I'd encourage grabbing, or I can pass it out too. Yeah.
Is the information you had available on your website or on
It's not. That's a great question. I kind of thought about that. I'm happy to email the presentation to you guys. Yeah, absolutely. Yeah, definitely. Yeah.
Awesome.
Anything else?
All right. Any other questions? All good. Good. Okay.
Okay.
Well, I'd like to thank you guys honestly for coming out and taking the time out of your Saturday to come do this, because this is really important to Lively, Kristen, myself, and ICANN Wellness. Our practice, everything that's involved with our practice, is we're trying to create a one-stop shop for everybody to have everything under one roof. From getting your blood work done to seeing for for a family practice, follow-up acute visits, and now you guys can see that we offer hormone replacement therapy. But really do want to thank you guys for coming out and taking the time out of your Saturday. And thank you, Kristen, for being willing to share your information, because it was extremely knowledgeable. I mean, honestly, I sat in it, even though I know a lot about hormone replacement therapy. I found out I only know like maybe 25% of it. So, and that's being open and honest and transparent, because honestly, at the end of the day, a lot of this information is newer information. We're kind of constantly seeing evolution in a lot of medical treatment. And I mean, these girls are just like myself in the regards of we're looking to investigate and further research to find out what is going to be the best treatment right now for our patients, and not just settling what we did 25, 50 years ago. You know what I mean?
Yeah,
so,
for sure.
Really appreciate it, and thank you so much, Kristen.
Yeah, thank you. Thank you guys for coming. I appreciate it.